All right. Hey, thanks you guys for coming in today, or if you're viewing, thanks for viewing. My name's Joe Moore, and I live here in Colorado Springs. I'm an insurance broker, and I specialize in Medicare. This is what all I do. I've been doing this since 2010. I really enjoy it, and today we're going to talk about the basics of Medicare. So Medicare 101, so when it's your turn to take advantage of your Medicare benefits, you can do that. All right, so let's talk about what Medicare is. So Medicare itself is the federal health insurance program for people that are 65 or older, or those who are qualified with a medical disability, typically at an earlier age. Okay. CMS is the government agency that makes all the rules for how Medicare works. CMS stands for the Center for Medicare and Medicaid Services. So if you ever get a letter from those guys, that's who that is. It's from Medicare directly. Okay, so let's get into really what Medicare covers. And first we'll talk about what are the main four parts of Medicare. So you're going to have Part A of your Medicare, which is hospital. Part B of your Medicare, which is your medical benefits. And you're going to have Advantage plans, Medicare cover. And D, which is prescription drug. So those are your main four parts of Medicare. So throughout the presentation, we'll talk more about what Part A costs. We'll talk about what Part B costs, what it covers, Medicare Advantage, and how those work, as well as how to take advantage of the additional benefits that come with most of these plans, as well as prescription drug benefits and how those work and the importance of those. All right, so first here, when enrolling in Medicare, when you can take advantage of these particular benefits, you have what's called your initial enrollment period. So your initial enrollment period is 3 months before your 65th birthday, the month of your 61st birthday, and 3 months after. So you have a full 7 months to decide what do you want to do with your Medicare. And that's important to decide between that time period so you can avoid any penalties that may be out there, which we'll also talk about as we continue to go forward. If you happen to miss your initial enrollment period, you have what's called your general enrollment period, where you can apply for Part B between January 1st and March 31st. And then those benefits will start July 1st of that same year. So that's if you miss your first period, you can always join at that next period window there. And then, of course, there are special enrollment periods. Let's say you decide to work past 65 and you're 66, 67, 68 years old, and you decide you'd like to retire from your employer. You can also join your Medicare plan at that time as well. All right, so let's dig a little bit more into exactly what your Medicare coverages are, piece by piece, as we go through here. So first we'll talk about Medicare Part A and how that actually works for you. So Medicare Part A is hospitalization coverage. So Medicare Part A covers 80% of your hospitalization. Medicare has, or Part A of your Medicare has a deductible of $1,408, okay? The Medicare will also, Part A will also cover hospice services if that's ever necessary as well. The deductible for Part A of your Medicare will cover the first 60 days in the hospital. After that 60 days is up, then you would have a daily charge for your hospital stay. And what does Part A cost? So the premium for Part A is typically paid for. So if you work 10 years or 40 quarters into the system, then your Part A is paid for. I have had clients who have not been at that particular number, and they may have to work a little bit longer and have a small premium until they reach those 10 years or 40 quarters. So that's part of qualifying for your Medicare there. So that's Part A for you. Again, Part A is going to cover 80% of your hospitalization, has a deductible of $1,408, and that deductible does vary from year to year sometimes, and these are the numbers you want to meet in order to have that paid for. So Part B of your Medicare is medical insurance or doctor and outpatient type surgeries. Part B of your Medicare also covers durable medical equipment, walkers and wheelchairs and oxygen, things of that nature. Part B also pays for Part B medications. Those are typically drugs your doctor has to give you in their office. Chemotherapy drugs, osteoporosis, oral cancer injection medications, those are things that the doctor gives you in the office, and Part B also helps pay for that. So Part B also covers preventative services, and the most important thing with Part B is that you take advantage of it. Make sure you enroll in Part B when you're eligible. If not, you may end up with a penalty for your Part B, and that's a 10% a year penalty, and that penalty never goes away. So it's 10% on top of the cost of Medicare Part B. So what does Medicare Part B cost? So depending on your income, you're going to have different variations of your cost of Part B. The standard premium for 2020 is $144.60. So that's what you'll generally pay for your Part B as coming in. If you qualify for limited income or Medicaid or extra help, a lot of times the state will pay your Part B premium for you, so you may not have a charge there. If you are a couple and you make more than $175,000 a year, then you will also have a higher Part B premium. And if you're an individual who makes more than $85,000 a year, you'll also have a slightly higher Part B premium. All right, and again, there's your Part B premium at $144. There is a deductible for Part B. It's $198.50, and you pay that once a year. And that again covers your doctor visits or a specialist visit type outpatient things. And again, make sure you enroll in a Part B when you're eligible or have another credible coverage such as an employer coverage, or you will most likely be penalized for not having your Part B when you're eligible. All right, so what are your options? So first, we'll recap really quickly. So again, Part A and B cover 80% of your medical benefit, and you need to decide how are you going to cover the other 20% Medicare leaves for you, okay? And also, how are you going to cover prescription drug coverage? Those are your two things that you need to figure out. So option one is considered a Medicare supplement. So a supplement or a Medigap policy is a secondary insurance that you pay for that covers or picks up the difference that Medicare leaves for you on the table for covered Medicare procedures. And also, you'd also need to purchase a prescription drug benefit. And those range quite a bit. And again, we'll talk more about that as we go. And before I go to option two, remember that no matter which option you pick, option one or option two, you must be enrolled in Part A and Part B of your Medicare to take full advantage of all your Medicare benefits. So option two is considered Medicare Advantage. And we'll get a little bit more in detail about Medicare Advantage here shortly, but Medicare Advantage's plans are administered by private insurance companies, and you get all your benefits of A and B. They give you additional benefits that Medicare doesn't cover, as well as a lot of times integrate your prescription drug benefits at no additional cost. So we'll dive a little bit more into Medicare Advantage here, which is also known as Part C of your Medicare. All right, again, those are approved and administered by private insurance companies, and Medicare or CMS sets all the rules for all these companies. And they say that the Advantage plans must cover the same amount as original Medicare, A and B, meaning at least 80% of your medical benefits or more. A lot of times those plans do cover more than that. All right, and speaking of things they cover more of, so a lot of times your Advantage plans will cover dental and vision and hearing and gym memberships and some chiropractic care, different things like that, that original Medicare typically does not cover for you, okay? Most Advantage plans are, in this area being Colorado Springs, or even the state of Colorado, are HMOs or PPOs. So HMO is Health Maintenance Organization. A lot of times with an HMO, you would have a primary care physician that refers you to a specialist or a hospital for your services, or a PPO where you may not need that referral. So there's two different ranges there on how your Advantage plan would work for you. All right, so what are the costs of Part C? Typically in this area, there are mainly zero premium policies out there. There are a few that do have a small premium attached to those. You could always go that route. If you are not sure which way to go, that's what I'm here for. So you don't have to remember all this. You can always reach out to me and I can help you decipher which way you'd like to go. But the main thing about Medicare Advantage, they are zero, but there will be co-payments. So there's set numbers. A co-payment is a set number that you will pay when you utilize your services. You'll pay a certain amount at the primary care physician, you'll pay a certain amount at a specialist, or if you're inpatient hospital or an outpatient surgery, if you need an MRI, they all have kind of a fixed cost to those. So, and again, they vary by plan, and there's lots of different ones out there. So again, I can help you with needing that. All right, so what are your enrollment periods for Advantage? So fortunately, they run very similar to your original Medicare enrollment periods that we talked about earlier. So with Medicare Advantage, you have your initial enrollment period, which again is 3 months prior to your 65th birthday, the month of your 65th birthday, and 3 months after. So again, you have a full 7 months to decide what you would like to do. After that initial enrollment period, we're quickly here, it's June now, so quickly we're going to be jumping into open enrollment. Open enrollment is typically my busiest time of the year due to the fact that anyone who has a Medicare Advantage plan, as we're talking about now, or a standalone prescription drug plan, which we'll talk about here shortly, they can change their plan that time of the year. So you have a full 7 weeks, October 15th through December 7th, to decide, do you want to add a plan, drop a plan, change a plan, switch a plan. You can do that every year from October 15th through December 7th. And there's also special enrollment periods. So throughout the year, let's say someone qualifies for limited income, they can change their plan different times throughout the year without waiting till October. If you move from one state to another, you can also change your plan without waiting for open enrollment. From one county to another, if you retire mid-year. So there's different reasons people can make plan changes. Again, if you're not sure if you qualify or have a friend or someone else who's not sure if they need to make a change, you can always reach out to me by phone, email, go to my website, however you want to do it, and I can help you figure that out. And then lastly, this is kind of new to Medicare. It's Medicare Advantage open enrollment. And I think this is a great kind of period they added. This is where from January 1 to March 31st, where if you have an Advantage plan, an HMO, you could switch to a PPO or PPO to an HMO. If you enrolled in a plan not realizing that it did not include prescription drugs, you can change to an Advantage plan that does have prescription drugs. So it's a great benefit in that window. That is also Medicare Advantage disenrollment, where you can leave your Advantage plan and go back to original Medicare and possibly get a supplement if you qualify medically at that time. Okay. All right, so we'll just jump into what Part D is. So we covered Medicare A and B, which is 80%. We covered your Advantage plan, talked a little bit about supplements. And this is going to be Part D of your Medicare, which is medication coverage, which I believe is the most expensive part of your plan. So it's important to understand how this really works for you. And I'm just going to click these bullets. Oops, sorry, I went too far there. But it's important to enroll in a prescription drug plan when you're eligible, unless you have other credible coverage. So Part D is considered optional, just like Part B. However, if you do not take your drug plan when you're eligible, you will be penalized by Medicare. And it's 1% a month every month that you did not have a plan. And that penalty, again, sticks with you for the rest of your life. The way to avoid that penalty is to make sure you have some sort of group coverage at work, that you're still working and don't need a prescription drug benefit, or if you qualify for VA, if you have TRICARE for life, things like that, where you may not need a particular prescription drug benefit. Also, if you end up with a penalty on your Part D, if you end up qualifying for LIS or Extra Help or Medicaid, the state will pay that penalty for you. So if you end up in trouble, again, reach out to me and I can maybe help you save some cost on a penalty that you might have added up on yourself. All right. So the important things I talked about Part D, I'm just going to click all these, is that they vary. So I believe the least expensive plan on the market right now is about $14.95, and they go up from there. And they vary based on the drugs they cover, the formulary, what pharmacies you go to. Are those pharmacies in network or out of network? So there's a lot of different variances in what you're going to end up paying for your medication. So again, I can help you sit down, really figure out which drug plan you might want and how you want to do that. The main thing to remember is the donut hole or the coverage gap. So any of you that are scared of that particular words, coverage gap or donut hole, here's how that really works for you. So in essence, you have 4 stages. So you have your initial coverage stage, and let me back up. So you have your deductible. If your plan requires that you pay a deductible, you'll meet that deductible. Once you meet that deductible, then you would go into your initial coverage amount. In your initial coverage amount, you have $4,020 each. So you'd have $4,020 set aside for you. You'd have $4,020 set aside for you. And that money goes toward the cost of the medication. And the key word is the cost. So if you go to your local pharmacy and you give them $2 for your copayment, but the medication truly costs $20, $20 comes off of that 40/20. So every time you actually pick up a medication, the true cost comes off of that 40/20. If you ever use that 40/20 up, and it does reset every year, but if you use that particular amount up in the same year, then you fall into what they call the coverage gap or the donut hole. At that point, instead of you paying a flat copay of, let's say, $2, $4, $100, $47, whatever the copays might be, you pay 25%. So for someone taking very expensive medications, they get even more expensive really quick if you start paying 25% for everything. All right. To get out of the coverage gap, you actually need to spend in this same calendar year $6,350 out of your actual pocket in order to get out of that stage. So the key way to stay away from this is, if you can, take generics or nothing at all if possible, but try to stay on generics. That'll help you a lot when it comes to the donut hole. All right, so that's the prescription drug benefit part, and we'll talk a little bit more about supplements and how those work for you, which again was option one of your two options, was the supplement side. So a supplement, again, just runs alongside A and B. So you have your A and B, and then you're going to have your secondary insurance through another private insurance company that's going to cover that 20% for you that Medicare leaves as well. All right. And again, those supplements vary depending on where you are, the zip code that you live in, your age, your gender, habits, whether you smoke or use tobacco. Those will affect your rates typically, and they vary on how much they go up, depending on the company that you pick. Some of them may have a higher increase than some do yearly, so it's important to really sit down and look at those things that you're looking for. So again, reach out to me when it comes to picking a supplement and why you want to pick that supplement based on the benefits and how they would actually work for you. Okay? All right. And if you guys have heard about the Part F, there was kind of a rumor that Part F was going away. It hasn't really gone away. What's really happened is, if your 65th birthday was prior to January 1st of 2020, then you can still get Plan F. Okay? You're kind of grandfathered into the Plan F plans if you'd like to go that route. If you were born, or if your 65th birthday was on January 1st or later, then you can no longer get Part F. You'd want to look at like an N or a G or a K or an L. There's a lot of them out there. And again, I can sit down and help you figure that part out. So F is not gone. You can still get it if you have your birthday falls on the right side of things. And then if you're born or a little bit later, then you would have to go with another route on that. And that is really it. Thank you again for being here. If you have any questions, we'll get to those here shortly. But again, that's my contact information. So please feel free just to reach out to me with any questions that you might have about anything. I get a lot of calls that just with general information questions. I'm happy to help with those. As well as you can email me or go to my website. I have some frequently asked questions there, and some of those answers might be already there for you. Okay? And then lastly, let's go through a few questions. Okay? Yeah, absolutely. So, the question that was asked is, if I have TRICARE, do I need to do anything? And the answer to that is yes. So if you have TRICARE, you're going to have your A and B of your original Medicare. But once you get TRICARE, it turns into TRICARE for life. At that point, your Medicare is going to become your primary. Right now you have TRICARE Standard or TRICARE Prime, something like that. But it's going to flip over. So it's going to become Medicare is your primary, TRICARE is your secondary. You will not need to enroll in a prescription drug benefit. Actually, if you do enroll in a prescription drug benefit, it would compromise your TRICARE. It actually disenrolls you from TRICARE for life. So again, we can sit down and talk more about advantages that you could take as someone who has TRICARE and go from there. But yep, A, B, TRICARE, you don't need a prescription drug benefit. Okay, fantastic. All right, any more? That's it? Yep. Okay, absolutely. Yep, absolutely, yep. All right, so your mom, okay. So the question that was asked, Her mom has low income, not sure what the numbers are to qualify for assistance in the area to help pay for prescription drugs. So again, the medications, or extra help I should say, what that's going to do, it's going to help pay your prescription drug cost. Okay, so instead of paying high cost, the state subsidizes your deductibles, it subsidizes kind of your copay, so they come in a lot less. And it's based on a sliding scale. So I believe the number this year is like $1,536 or less. So if you make less than that, or if your mom would make less than that, then she would qualify for extra help, and I can help with an application for that with Social Security, and it takes a few weeks to go through, and then we can get some help for her on her medications. So yeah, call me afterwards, or we can talk and figure that out. Yep, awesome, thank you. And that's it there. All right, so again, thanks everyone for tuning in or being here. Thank you, and again, I look forward to helping you, and you have my contact information. Oops, and again, look forward to taking it. Thank you so much for your time today.